tell me how you trying to implement the project so that the rural healthcare system will get benefited out of this?
I mean, I don't think I'm saying. I think already answered that question, which is that I think you can either deny that they exist, and given that most of the healthcare is provided by them, you can then bear the consequences, or you can actually recognize their existence, and then you can actually regulate them, you can train them, you can require standards of quality. আপনি অনেক বলেছেন আর আরেকজনকে বলবেন
Yesterday you said that what worries you the quality of education. So are you going to do anything like what Professor Sen did after getting Nobel? Do you have any idea on that?
No, I haven't thought about it.
And what is the, I mean, when you are worried about this quality of education, what is your...
I've done 25 years of research on it. I'm worried about it. I've already paid my dues a little bit to it. And we're still working on it. We still try, a very large part of my own work in India is on education, trying to improve the quality of teaching. And most of those are with Pratham, and many of them are published. You can look it up. It's very much, one of the things that the Nobel Prize Committee recognized is that body of work on education in India.
Professor Banerjee, there is a program in West Bengal called Kanyasri.
I don't know enough about it.
So there is a direct cash transfer to the girl child to continue their studies up to 12 and then...
I don't know enough about this. I'm not going to speak. I reserve the right to be ignorant about things and not answer them. I'm not supposed to be the person who knows everything. I'm going to insist that that's important. We should speak about what we know and not just use this as an opportunity to air opinions about everything.
Okay, thank you.
Professor Banerjee,
I think you've asked. I'm going to let somebody else ask. You did. I'm not that.
भारतीय अर्थव्यवस्था से आप संतुष्ट हैं और क्या
English में पूछिए.
You are happy with Indian economy and what you have been with PM?
I won't answer that. Ask a question that's more specific than that.
I at the very outset, I tried to, because this was really all through the day we had stormed our brains, and Abhijit has contributed tremendously. So it would be great if you use this opportunity for, healthcare planning in the country, rural healthcare delivery in focus, or his areas of research, which all of you know, you must have done your homework on this. And so please come forth with some information which would use your, copy also. Go ahead.
What's your opinion about Ayushman Bharat program?
I think it's a very needed. It does something very important, which is it deals with the fact that healthcare expenses wipe families out. And it does something very important there. I think it's something that we need. We need to find ways so that families don't lose all their assets when somebody in the family gets sick. So I think it serves a very important gap in our economic structure.
So what was your recommendation of today's meeting about the healthcare?
It's not the kind of meeting that has a recommendation, but it was a meeting which was very fruitful. I thought I learned a lot, and I think it was starting a conversation with the Niti Aayog in particular and with ICMR on what do you do about this world where there's enormous amount of kind of healthcare that's provided outside the formal healthcare system. So that's what this conversation was about. Most healthcare, like majority, much more than a majority of healthcare is provided by people who are not recognized as healthcare providers. What do you do in that world? That's the question.
How can we develop the rural health problems? What's your suggestion? I'm Indrani from Calcutta.
I don't understand the
How
question.
can we develop our rural health problems?
Problems.
What's your suggestion, sir?
Yeah, there are so many issues. Indrani, can you be a bit more specific for him to answer?
Palestinian problem and lots of women's problems we face in India, sir.
Look, you know, again, I don't have anything particularly useful to say about that. I mean, I think we're all struggling with this problem that, you know, there is Dr. Paul, who was speaking here an hour ago, was making the point that behavior change is very important because, for example, you know, the exclusive breastfeeding rates, which are critical for our children, is only 50%. So I think we have to somehow figure out ways to get women who are critical agents in this to be more full participants in this program of making our children and our country more healthy.
Professor Banerjee, are you happy with the way we are?
All right, that was Nobel Laureate Mr. Abhijit Banerjee in a press conference soon after having met with the Prime Minister today after a major feat for having being named for the Nobel in economics. He's of course been in the country giving interviews for the past week, essentially also to promote his latest book, which is Good Economics for Hard Times. His brief conversation with the Prime Minister, as he stated, was of course touching upon Nyay, a scheme that was floated by the Congress for the general elections, talking about ICMR, about healthcare expenses in the country.